is Chicago's very own WGN News.
A new study released by Northwestern University found gun injury care cost hospitals nearly $8 billion. That's from 2016 to 2021. The Medicaid covers a majority of the cost connected to gunshot injuries, a total of 52% of the cost compared to 20% by private insurance. Joining us now to talk more about the impact on the healthcare institutions is Dr. Ann Stay. She is one of the co-authors of the study, also an assistant professor of surgery and a Northwestern medicine trauma surgeon. Doctor, thank you for being with us. We appreciate it.
My pleasure. Thank you for taking the time to talk.
Yeah, so gun violence takes just a devastating toll physically, emotionally on families, individuals, and healthcare systems. So let's talk about that. Give me your big view first, and then we'll dig into the results of the study.
Our big view is that this is an extremely costly problem. As you said, it was, over $7 billion between 2016 and 2021 nationwide was the cost of taking care of people with firearm injuries. And so really just looking at cold, hard numbers and what that really means is critical for us as a country, especially in times of austerity, to make better decisions about how we're spending our taxpayer dollars.
Okay, so we're really digging in here to the financial impact here. Take us through what normally happens when patients are injured by gunfire and then they go on and get treatment. Take us through what happens for them and how those costs get covered.
So the majority of patients are taken to the emergency department, either by their families, themselves, occasionally the police, and of course EMS. And actually, many people, luckily, have a more minor injury and are able to then be evaluated, stabilized, and treated in the emergency department and discharged. Unfortunately, there's also a percentage of patients who end up being more severely injured and actually need to be admitted to the hospital, or that need critical surgeries or critical care treatment to save their lives. And so when that happens, that is, of course, much more costly because of all the tests and the procedures and the physicians that are taking care of folks to be able to save their lives.
Do you have a sense of, like, per patient? I know it depends on the severity of the injuries, but is there an average cost per person that gets passed on and covered by tax dollars?
That's right. So around just an ED visit costs about $1,700 on average during that time period. And if somebody is admitted to hospital, then it costs around $38,000.
Wow. So obviously when they're admitted, it really takes off. So with Congress cutting Medicaid coverage, tell me what you expect, or what you fear, I guess, would be the long-term impact on our nation's healthcare system.
Well, I do have to say that this study was looking at retrospective trends based on what was observed, particularly around the time of COVID, and looked up through 2021. And so our study comments specifically on that. We did, as you mentioned, observe that Medicaid accounts for a large proportion of the patients, of the costs of care for the patients that come in. And as a result of that, we do know that presently at this time, because in many states, not all states, but many states, Medicaid actually reimburses the hospital less than what the hospital actually spends in taking care of the patients, the actual cost of care, which was at $38,000. That means that the hospital's left with a gap that they have to somehow fill because they don't get reimbursed for the full cost of care. And so that's what's happening presently. And so as you can imagine, if there are cuts to Medicaid, how that would potentially negatively impact hospitals further, if there are fewer people that even have Medicaid at all, right, or even have insurance, that would make a bigger hit to the hospitals potentially. So, but again, this study did not specifically forecast the cost of the people losing Medicaid coverage and how that would impact hospitals financially.
Published in JAMA. Just quickly, what do you hope the public takes away from reading this?
I really hope everyone understands the cost and how expensive it is for health systems, and ultimately that gets put on the taxpayers. And so really thinking about when we're making decisions, how we're spending our taxpayers' dollars and what we're willing to pay for, this is an important thing we should consider.
All right, Dr. Ann Stay at Northwestern. Thanks for being with us. Appreciate it.